Welcome to the Learnskin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Our skin is our first line of defense, our largest organ, and a major component of our physical identity.
It plays an important role in our health, psychology, and how we connect and relate with those around us.
So join us as we delve into the art and science of skin health in today's episode. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists.
Yes, we are.
This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learn Health, Inc. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional.
Absolutely not.
This podcast does not constitute medical or professional advice or services. If you have a medical concern, please consult with your physician.
Hey, Raja, how are you today?
Hey, Hadar, how are things going?
So far, so great. You know, one thing you didn't realize is that when we recorded the last episode, I actually had you frozen. And I put you under hypnosis, and the key word was, "Hey, Raja, how are you today?" And you came back to life, and it worked just perfectly this time.
You got me. You got me real good. So I think we're talking about hypnosis today, right?
Oh, I am so curious. I can't tell you how many people have asked me about this, and I always think, I don't remember that lesson in medical school. What is this thing about?
Yeah, I didn't get it in medical school either. However, we have an expert with us, so thankfully we don't have to try to figure this whole thing out. We have Dr. Lisa Lombard, who is a clinical psychologist, and she's been doing general psychological services and specialized mind-body treatments to children, families, adults for 25 years, a lot of experience. And she has quite a bit of experience with hypnotherapy and hypnosis. She's also a research assistant professor at Northwestern Medical School in the Center for Food Allergy and Asthma Research. And Lisa, I'd like to welcome you to the podcast. Welcome.
Hey, Lisa, welcome.
Hi, thank you very much. Good to be here.
We're really excited to have you here. And, before we jump into things with you, I've always thought most psychologists will take on some aspect of mind-body. What drew you into hypnotherapy? And is that something that you learn as part of your regular curriculum?
Yeah, well, I think it's always interesting because one of the things that I've been curious about as a psychologist is just essentially what makes people tick. And it is an artificial distinction to say it's either body or mind. We're one whole unit. And I was just really fortunate when I was studying at the University of Chicago. I was able to work with Erica Fromm in her self-hypnosis research lab for a number of years. So it actually was part of my academic training, even though it was very uncommon for that to be part of graduate school. And from there, I ended up incorporating it into my psychology practice over the years and have really sought additional training so that I can work with kids and also integrate other types of mind-body practices like mindfulness into my work.
So for people who don't know what that is there a difference between medical hypnosis and hypnotherapy versus some stuff that we see maybe on a video on YouTube or something like that where there's an entertainer that does it? Is there a difference there, or are there similarities?
Well, you're absolutely right. And it's a great question. Yes, there is a difference. So medical hypnosis is hypnosis applied to medical concerns, or hypnotherapy is psychotherapy that uses hypnosis as one tool within the general psychotherapy. Those things that you mentioned that are videos or we see on TV or at shows in hotels, that's stage hypnosis, and that's really not something that has a clinical application. It is something that's very different from the work that I do and other healthcare professionals do when they use hypnosis. But we all actually have the capacity to some degree to feel some hypnotic types of experiences. So those stage hypnotists capitalize on that and build a whole show around it.
I'm so glad you asked this question, Hadar, because up until now, I have to say, I thought I knew a little bit about hypnosis, but after that answer, I essentially know nothing about medical hypnosis.
Yeah, so maybe, Lisa, you can paint us a picture, because when a patient comes into your office or treatment room, or where do they actually go to get this kind of therapy, and what does that entail? Because we all have a good idea of what it is to go to the doctor's office, to a dermatologist, to a gynecologist. We all have these kind of ideas of what's going to happen there, but I don't know that we are clear about what's happening in your office.
Sure. Well, so of course it would vary. For me as a psychologist, people are coming to me and seeking my services out because they anticipate they might want to blend the hypnotic experience into the psychotherapy. But it can also be delivered in primary care physician's office, specialty offices, in the hospital, right before procedure, for example. It's used quite effectively for pain management and some types of procedures for kids who are being vaccinated or having blood drawn, things like that, where either in the pediatrician's office or in an outpatient specialty clinic or inpatient, a variety of people are now trained to use hypnosis to increase someone's comfort and help them manage the pain. It's integrated into cancer treatments. So, ongoing at home or in clinics, patients are able to help themselves feel more comfortable and reduce nausea, things like that. Hypnosis is really, and there's some debate still about a real definition, but it's often been thought of as an altered state of consciousness. But more recently, we're really thinking of it as an imaginative experience where a person is deeply absorbed in some sort of imaginative experience. And through the use of heightened imagery with all of our senses and the treatment suggestions, which are really those things that we want to incorporate for a good outcome for someone, it's the suggestions that make this the treatment, really. So hypnosis helps us become open to suggestion through involving our senses, allowing us to be deeply absorbed. Everything else fades off into the background. There may be some elements of a person experiencing what's called time distortion, where time might seem to fly or to go very slowly. And things like that are hypnotic types of experiences that then the clinician weaves in with suggestions for change.
That's excellent. And actually, there's a question I wanted to ask because you mentioned this as being some state of altered reality for the person himself. And I'm wondering if there's a susceptibility for people, and is that different among people? Do you have to have this great imagination in order to do this? Like, I know Raja's a musician, he has great imagination. I imagine one day I'll have imagination. So is Raja more likely to be able to go under hypnosis, or will it be more effective for him as opposed to me?
Well, there's certainly been some research. Nothing is really conclusive about whether or not there are any personality traits that are more associated with hypnotizability. But we think of it as essentially a normal distribution. There are some people who are really, really highly hypnotizable. And in fact, you kind of are touching on it, that often people who really enjoy some of the more creative arts, who I always talk with folks about, if you just like to read a novel and you start and suddenly the whole afternoon has passed and you don't even notice it and you've become so absorbed, that's a type of hypnotic experience. So that's a good indicator for me that someone might find this beneficial because they have that capacity. There are lots of other situations with music, with dance, with repetitive movements. Runners experience it. So we have sort of a range of experiences that are all almost first cousins to this more medical or clinical hypnosis.
Gosh, that raises a question for me. Even taking it one step further, when I was younger, we used to play video games all day long. And
Uh-huh.
sometimes, you're looking at a screen, amazing imagery, all kinds of suggestions. Definitely
Hmm.
didn't hear what a darn thing my mom was saying.
Right. Hmm.
So was I in a hypnotic state during that time? Because I'd like to call my mom and let her know that.
Well, you probably were in a variant one, in a variant of one. Yep.
Very, very interesting. Yeah, I guess maybe almost every teenage boy, or now, everybody's playing these games. We've all gotten
Right.
cloned to some extent then.
Yeah. Well, by design, they've been built to capture one's imagination. So you're absolutely right.
Oh.
So I think one thing that's probably on the minds of all our listeners is, how do you connect to medicine and dermatology specifically? Because I can think of a few applications for altering this, but before maybe even getting to that, maybe you can describe what are the goals when you use hypnotherapy as a therapeutic. So you mentioned some idea about pain management, for example. That can be one utilization. What typical scenarios do you use hypnotherapy for?
Absolutely. Great question. So I like to think about it as being effective, as in particular, when we know that if stress can make the symptoms worse, then managing the stress is very often a way to help the patient not have such intense symptoms. So I've been able to find it useful, especially when I'm seeing some patients with eczema, where we know that there are certain things in their world that may be stressful and seem to lead to flare ups. And when those stressful relationships or decision making processes or whatever it is that is their particular stressful event can be better managed, and they can experience some relaxation around that and kind of calm down literally the central nervous system a little bit, the impact is that they're better able to manage their eczema and not experience all of that flare up. So that's one kind of application. There are other types that are more about habits. So some of the picking habits, skin picking and hair pulling, those habits can be altered and people can learn some different kinds of responses to the tension that they feel right before doing some of those behaviors. And so in hypnosis, new strategies can be introduced and suggested. So in a relaxing experience of the hypnosis, they can really explore an alternate or a different kind of response instead of scratching or picking or pulling with something that's become really detrimental to them.
So I wonder if you can give us an idea of the evidence to support this. You're a researcher. You mentioned this was part of your graduate studies. And somebody listening to us now may say, well, is there a body of evidence to support this kind of work? And maybe you can give us an idea of what kind of evidence and where does it exist, on the hierarchy of evidence.
Yeah, I will say I wish that there was more really solid confirmed evidence that comes from randomized controlled trials. There are a couple in the field of GI issues. So, gastrointestinal issues right now, what some of us might call functional abdominal pain. There's really a new gold standard that using hypnotherapy is a very efficacious treatment for many folks who have GI issues. There's less evidence that I'm familiar with in the world of dermatology as a specialty, but there are a number of clinical studies and some that have sort of medium or moderate levels of efficacy for eczema, for itching. Certainly, the pain management in general has some nice applications that are research based, and then that those can be translated into the dermatological world. But there haven't been too many randomized controlled studies that are really looking with larger samples at the use of hypnotherapy. Although the one exception is with warts. There is some interesting work done with using hypnotherapy and wart removal.
You mentioned something about randomized double blind. How do you double blind for hypnotherapy? What would be the control typically in those sorts of studies?
Yeah. So sometimes it's something that's a relaxing experience. Somebody's just talking about some scene or image, but does not engage all the senses, and certainly doesn't have those suggestions for a behavioral change or for a sensation change to take place in the individual. Sometimes it's psychoeducation. I've seen that as the control of handing someone a tip sheet or a piece of paper to read that has the some equivalent information about managing the problem.
That's fascinating. One thing that I'm wondering now, we heard that there's maybe some evidence in other fields and some emerging evidence maybe in dermatology, but also sounds like it's very useful in practice. And we know that you collaborate with one of our colleagues that's been on the show a couple of times, Dr. Peter Leo. So I'm wondering if I'm now in Miami and I want to find a certified person, somebody that I can trust, is there a resource that I could use to track down a person that has the right training? And if I do, if there's a resource, what should I look for? What kind of training does a
Mhm.
hypnotist have?
Absolutely. So first and foremost, the individual should be licensed and credentialed in their own discipline. So I'm a clinical psychologist and I'm licensed by the state of Illinois to practice as a clinical psychologist. If you're an MD, you need to have that licensure. If you're a social worker, et cetera, et cetera. So the training in one's own home field is the first important criterion. And then after that, there are a couple of national organizations that have some excellent training, and they've been around for a number of years. So the American Society of Clinical Hypnosis is the organization that has training requirements in order to become either certified, as you said, or the higher level is called an approved consultant. And so that's someone who can then work with those who are in the learning process and who have had, I believe it's at least 5 years of practice after having received their certification from the American Society of Clinical Hypnosis. So I recommend that organization highly. And then another organization is called the National Pediatric Hypnosis Training Institute. And that also works on the same system of offering intensive, multi tiered training workshops for people who are working with the pediatric population and integrating clinical hypnosis. And that's across disciplines, again, of physicians, psychologists, social workers, nurse practitioners, I think occupational therapists. There are a couple of other specializations, as long as you're a licensed provider who can also obtain that kind of hypnosis training. And then different regions of the country have some regional organizations which are considered component sections of the American Society. So here in Chicago, there's a Chicago Society for Clinical Hypnosis, which is part of the American Society. And I'm actually currently the president of that chapter. So if anyone's interested in the Chicago area or finding out more about these other regions, those are some resources.
That's great. And kind of begs the question now with the ongoing new approach to medical care and delivering care in the COVID environment. What about telehypnosis? Is that something that is possible through, say, video conferencing?
It absolutely is. So we have just been, a lot of colleagues and myself have been busy talking about what are the new guidelines and parameters for that. They're just about to be issued from the American Society of Clinical Hypnosis, but certainly people are providing telehypnosis right now. Some safety caveats in terms of, just like any other patient, you would want to know quite a bit about them in advance to make sure that they were suitable, that they're in a safe environment with some privacy, of course, as well as any kind of backup if your internet connection goes out and that sort of thing. But it is being delivered, and there are a number of, in addition to telehypnosis, there are some apps that are being delivered and developed related to that as well.
I think that especially with everything that's going on, another aspect of hypnosis that I think might be attractive, and I'd like to hear what you had to say about this. We'd love to all refer to someone like you, Lisa. That would be great. Are you able to? So you have to be licensed in the state that the patient resides in. Is that correct?
That is correct. However, in our current situation with the pandemic, many, many states and professional organizations have, at least as I understand it, temporarily lifted that so that there are some ways now for a clinician in one state to deliver services to someone who lives in another state, even if he or she isn't licensed in that other state. I think that has been waived, but on a temporary basis.
Yeah, and we'll see where those guidelines end up. And then with time, one of the things that's going to become very apparent is already, there's a lot of, I know you're talking about eczema and we talked about like some of those dermatology factors. I'm wondering, is hypnosis, and we were going to ask you about self-hypnosis, if that's a possibility, is that a potential avenue of treatment for things like burnout or physician burnout? Because we know that's become a huge issue in the physician and health practitioner community.
Mhm.
Does hypnosis have a role there?
Absolutely. That's a kind of exciting area because it ties in so nicely to self hypnosis, as I think you're already suggesting. So, hypnosis can be taught so that you on your own would do what we now call self hypnosis. So, it could be with a recording or just having practiced with your own clinician. You now have enough tools. And that's really a great lifelong skill for stress management, for coping, for what we who work with kids call taking an imagination vacation. And you carry it around with you wherever you go. You don't need any special tools. You have your own imagination. You can use modified breathing and other breathing techniques to enter into a hypnotic experience and to really explore some of your thinking about, when we're talking about burnout, but also to just provide yourself with some time and respite for some stress management, some healing, and to be able to make some good decisions and have really strong problem solving skills back online.
Wow, Lisa, that was a great overview. And I'm wondering, before we wrap this up, I'm wondering if you could give us maybe an example or success story you had in taking care of a dermatology patient, because I think that will
Hmm.
give me and our listeners some idea of how this thing works and how you can assist a dermatologist or any other skin professional in taking care of patients.
Yeah, there was a young lady who was a college student and had had a number of concerns about her skin with some eczema, with some hair loss, and a couple of other stress related symptoms that all seemed to be one package. And really, it was about helping her develop some stress management skills using that hypnosis and learning self hypnosis because she was about to go back off to college and back to the dorm after a break. And it was quite exciting and kind of fun to work with her and gratifying because it took just 2 or 3 times for her to begin to notice that she was really able to manage the stress, even though she was back home living with folks for a while and anticipating going off to college and wanting to be more successful. The stress management skills themselves started to help her notice that her skin was calmer, that the eczema wasn't as uncomfortable and noticeable, and she didn't need to wear all that makeup. And so it was a whole cascade of changes that built upon one another. And she just went off to college after these 2 or 3 sessions. And I'm glad to say I haven't heard back from her. And she had really accomplished something that she felt very proud of. And I think that's what's key is that people walk away feeling like they're doing something for themselves.
And I think what's interesting here is what a key principle of an integrative medicine is really trying to change behavior towards a healthier behavior, which is something that sometimes is hard to get to in Western medicine, where we're very pressed for time and
Hmm.
there's no real avenue for physicians to go through this. So it's great to have a resource like this on the side to help patients really cope with this. And even for pain or other applications you suggested, that's
Hmm.
a wonderful addition to our toolbox.
Absolutely.
Yeah, and I have a question for you, Lisa, just as we're wrapping things around this conversation on hypnotherapy. How would you compare or contrast hypnotherapy or hypnosis to, say, another mind body approach like meditation?
Well, I and other people will often say that they're essentially first cousins. Some people think there's even more overlap than that. There are a couple of differences. So, with meditation or different types of mindfulness based exercises, there's often a really a narrowing of attention, and that's very deliberate and intentional, and that's decided upon even in advance, perhaps, of what is your attention going to focus on, and how do you continue to return your attention to that when your mind drifts away. Whereas with hypnosis, there may be much more of an expansive set of attention that's expanded, that might be responding to new things and new ideas and a curiosity. And so I think it flows in a little bit of a different direction. And that's an experiential difference. And then the other significant difference is that mindfulness and meditation really take place without suggestion for change, just as you were saying with that behavioral component for integrated medicine and behavioral health care. Whereas with hypnotherapy, there is a known goal of some sort of change that's in the service of helping that person to feel better or making the symptom less uncomfortable or helping with healing. And that's very deliberate that based on one's clinical interview with the patient and knowledge of the problem and the situation that the person's living in, those suggestions are going to be embedded into the hypnotic experience so that long after that hypnosis session is over, there still continues to be a change process for the person.
Gosh, that couldn't have been said any much better than that. Really put the point of how hypnosis works in this mind body approach. Dr. Lisa Lombard, thank you so much for coming on and giving us an overview of hypnosis. I was definitely hypnotized during this podcast, but I don't mean to say that with too pejorativeness in nature, but I do really find this area fascinating, and we appreciate your expertise in taking us through it.
Yeah, thank you so much. This is fascinating.
Absolutely. Thank you for giving me that time and your interest and attention in it. I think it really is a fun thing to use as a part of your toolbox.
Thank you.
Thank you for tuning in to today's episode with Dr. Raja and me, Dr. Hadar. This podcast is brought to you by Learnskin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs or subscribe to the podcast today and never miss an episode. Have a great day and stay curious.